Health and Social Services and your moderator for the COVID-19 update for Friday, May 15th. We are joined today by the Yukon Premier Sandy Silver and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have one question plus one follow-up. Because of the importance of today's announcement, we will entertain a second round of questions. Again, you will be called by name. Our French-speaking journalists are encouraged to ask their questions in French. With us today is André Boursier from the French Language Services Directorate to translate those questions for those who do not speak French. Thank you. Premier Silver?
Thank you very much, Pat. Good afternoon, everyone, and thank you for joining us. Today we are releasing a path forward, Yukon's COVID-19 recovery plan. This is Yukon's plan for lifting COVID-19 restrictions, and the plan outlines how we are looking at easing restrictions and setting the roadmap for our eventual return to a new normal. I'm very happy to share this document with Yukoners today. This plan includes a number of phases, including the response phase. Now, we have already added guidelines for allied health professionals, optometrists, and retail businesses, recognizing that childcare is key to people being able to return to work. We have also developed guidelines for summer camps so that they can continue their operational plans for the summer. Guidelines for daycares and day homes are being finalized and will come out very, very soon. We are entering into phase one. As we are entering into phase one, our goal is to loosen public health measures while keeping Yukoners safe and healthy. We are working to get businesses that were mandated to close the supports that they need to open back up where appropriate. We do know that some will remain closed into later phases, but those that can open safely, we want them back up and running. These include personal services and restaurants. Personal services and restaurants will need to develop an operational plan and have that plan approved by the Chief Medical Officer of Health and his team. Officials are available to help businesses develop these plans and will work with them to review them as quickly as possible. There is a template available as we speak on yukon.ca that can help you to develop these plans. Now, if your business was not mandated to close and is in a position to operate safely, you also will need a develop an operational plan, but you do not need approval of that plan before you open. Again, there are officials who can help you out with this plan if you want to, and you can follow the templates that are available on yukon.ca. For Yukoners in general, it means that we will be easier to reconnect with one another. Up until now, the recommendation has been to practice physical distancing of at least 2 meters around anyone that is not a member of your household. If you're outside, you can still socialize with others outside of your household, providing that you're practicing safe distancing, physical distancing. But we are here to announce as well the household bubble concept, but I'll leave that to Dr. Hanley to describe to you. But safe to say that we are opening up a bit of the provisions for households. We are heading into another long weekend, and it's a good time for us to be a little bit more able to move amongst Yukoners. While it feels like we've been dealing with COVID-19 related impacts for an absolute long time, we are still on our first steps of a pathway forward. We are able to begin phase one because of the vigilance and precautions of Yukoners. Thank you very much. We would not be here today in phase one if it wasn't for the diligence of all of you. Thank you very much. This vigilance must continue if we are going to continue to move past phase one and into phase two, etc. So, while we begin to open things up, Yukoners have to continue to practice physical distancing. We all must continue to wash our hands, and to stay at home if we are sick, avoid gatherings of more than 10 people. We are still asking people to limit their travel to communities. To the orders on self-isolation when returning to Yukon and the strict border restrictions, they're still going to be in place for some time. Today we begin phase one. Like any path, we are on our very first steps. There is still a long way to go. We will be using an objective, risk-based approach that will guide our reopening next steps to begin allowing for more flexibility for Yukoners and Yukoners at home. We know that it is time to lift these restrictions for the sake of our mental health, for our social and economic well-being, and because it is safe to do so. We also know that there are risks associated with going too fast, like having to turn back the dial and tighten up again. This pathway is not a one-way street. The plan speaks of triggers for moving forward and triggers for an unfortunate step backwards that we all hope that we will not have to take. Our goal is to keep border restrictions and enforcement of our CIMA orders tight so as to allow Yukoners more movement within the territory and enabling greater freedoms and flexibilities for Yukoners at home. Even as we progress through the initial phases of reopening and getting Yukon residents back to work, border controls will remain in place for the time being. This is because importation of COVID-19 to Yukon is still our greatest risk. Tight borders in Yukon will be with us until transmission in our jurisdictions and other jurisdictions is under control. I want to thank the enforcement officers who are working across the territory to keep people informed and to keep our territory safe. Everyone even if we begin relaxing health measures and reopening society, it remains a real possibility that strict measures will be needed to be reinstated. This is a marathon. It is not a sprint, as we said last week, and we are still in the early phases of this pandemic. We thank everybody for their cooperation. What a wonderful place we live in, and for making so many sacrifices. Because of the hard work that you have all done, we are able to be in a fortunate position today. So thank you again for your diligence, your commitment to safety. What we are facing as a society is absolutely not easy. It is not comfortable, and it is causing considerable stress to Yukoners. Be kind to each other, check in on your friends and your loved ones, have a safe long weekend, sticking close to home, but getting out and enjoying all that the territory has to offer. Thank you very much. Dr. Hanley?
Thank you, Premier. Good afternoon, bon après-midi, Danacha. Another historic day for Yukon begins as this tumultuous journey we have been on takes another turn, a turn towards life, returning to some semblance of normal. So much has changed in our lives since that first week of March when the pandemic invaded our world here in Yukon. But the steps taken that day, with the introduction of what became a series of restrictive measures, has set Yukon on the right path to protecting its citizens from the sly and fickle spread of COVID-19. Early on, as we tracked the disease around the world and through Canada, and indeed into our own territory, we did not know when we would be able to lift any of the restrictions. So I'm happy to be here today with the Premier as part of the announcement of the plan for how to start lifting COVID-19 restrictions and return our lives to some normalcy. We are only able to do this because of the government's and your adherence to public health advice and direction early on. The swift and strict closure of our borders and mandatory self-isolation of anyone coming into Yukon has helped to keep COVID-19 at bay. Encouraging all of us to stay close to home has also helped, and cooperation from all Yukon citizens has made that possible. Our successful following of those rules means we are now finally able to move progressively to a more accessible and open society, as much as we can afford to while staying safe from the pandemic. On the household bubbles, as of now, a household may now choose one other household to spend time with without physically distancing. And both households naturally have to agree on that arrangement and not have close contact with anyone apart from these two units. And so that those two combined units will be known as a two household bubble or double bubble. And members of the household may not join up with more than one other household or bubble. So it's a two household bubble. And of course, this is again like all the other measures. It does not mean that the threat has gone. It may be something that we'll have to clamp back down on if we did see increases in cases. So more guidance on that will be coming out in time for the long weekend. So some of the more specifics, but really that's the gist of expanding the domestic bubble to two instead of one households. Last week I spoke of those who were fearful of opening too soon and those who think we're not opening soon enough. And we've taken all of those perspectives along with the best evidence into consideration as we've built the public health approach to this pandemic. In order to open up, we need to keep certain things closed. In order to loosen, we must hold tight in other areas. It's all about balance, and our first priority for now is keeping the risk of importation down. Our borders will remain closed except for critical and essential workers, returning Yukoners, non-resident family members of Yukon residents, individuals transiting through to Alaska or NWT, and those exercising treaty rights. I've spoken about international flights to Yukon, and they will not happen this summer. We do have and will maintain our ability to keep our borders strictly controlled. If we continue this strategy and if we keep tightly applying the Safe 6 rules, we can begin our slow, steady return to the quasi-normal. Working with our public health colleagues and taking advice from experts around the country, we have built a public health framework forming the basis for the reopening plan and each of its phases. Within that plan, we've laid out the criteria for transitioning from one phase to the other. We continue to improve our means to measure not just the standards needed to maintain our safe status in a territory, such as healthcare and testing capacity, but also the spectrum of impacts that result from either COVID effects or the consequences of our preventative measures. Ongoing surveillance will inform how we respond to the many unintended consequences of the pandemic restrictions. It'll also help us to balance people's well-being with the need to prevent the spread of COVID-19. Our approach will be slow and measured. We have had the benefit of watching some other jurisdictions roll out their plans. We're continuing the work to provide guidance to businesses, workplaces, and healthcare providers that will allow them to loosen earlier restrictions, to reopen, to provide goods and services in a safe way. Today's announcement does not mean we're turning the lights on fully. It's more like opening a dimmer switch a little more. So today we've added guidelines for summer camps and retail outlets. And this is also a heads up for personal services and restaurants. Many of you have asked for advance notice of when you can reopen. Well, we are now in phase 1, but actual opening is a few short steps away. You won't be able to open a restaurant or hair salon doors today or Tuesday, but in the very near future, you will be able to open as long as your operational plans are in place and approved. We're currently finalizing guidelines that will help you write your plan and putting the pieces into place to allow for as rapid a turnaround process as we can manage. Those businesses that were ordered closed under the Civil Emergency Measures Act and are regulated under the Public Health and Safety Act will require approval of operational plans before opening. Restaurants, of course, can continue to provide takeout and delivery services, but like other businesses, must now submit an operational plan to environmental health by May 29th. Dine-in restaurant service guidelines are close to completion. In fact, I was just editing them before coming over here. Restaurants wanting to implement dining in can begin working on an operational plan based on these guidelines and will be able to open once the public health orders for restaurants have been lifted and an operational plan based on the guidance is submitted to the HEOC, that's the Health Emergency Operations Center, for review and approved. Personal care services such as hair salons, barbershops, tattoo parlors, nail salons remain closed for now. Similarly, they can also start working on a guideline-based operational plan in anticipation of opening after confirmation from HEOC that the plan is approved. Both restaurants and personal care services will be subject to inspection by environmental health officers who will be in a position to review both the plan and the premises to ensure compliance. Bars are higher risk establishments. They will remain closed for now. Once phase 1 is well underway, guidance for bars will be issued and individualized risk-based assessments will be provided to allow those bars with sound and safe operating plans to reopen. Bars will likewise be subject to inspection. Due to the demands of inspections and a limited capacity to provide oversight, bar openings will be phased in as our oversight capacity allows. Other businesses and organizations which are not regulated under the Public Health and Safety Act must develop a plan, but are not required to submit it for review. In the event that an occupational health and safety officer or an environmental health officer performs a site visit, employers may be asked to produce a copy of the COVID-19 operational plan. Our way forward is clear. We will take a step and watch for as long as we need to be sure before taking the next. It'll not be a fast journey, but it is how we will move ahead. There have been many interesting analyses on the interaction between the pandemic and the economy, and one I particularly like is an MIT study which suggests, based on data from the 1918 influenza epidemic, that it is much better to take the economic hit from the pandemic full on and then reopen when all is safe, rather than to try to run an open economy while the epidemic is still in town. Don't try to have the two compete. Get past the pandemic or keep it at bay and then reopen your economy when it's safe. That slow approach is actually the fastest way to recover, a tortoise and hare story in real life. Thus, this first opening phase in particular needs to be sure-footed, slow and careful. COVID's reality is never far away, and we have seen that when COVID hits, it has no mercy. Death has been very much a part of COVID-19, and we have all watched the national death numbers increase. This week, we were all saddened, I'm sure, to hear of the first nurse to die from COVID-19. That nurse worked in continuing care. As we pointed out on Tuesday, this is National Nursing Week, and in addition to everyone else I mentioned earlier this week, nurses in acute care, public health, and community care, I would like to recognize the work of our nurses working in long-term care. Along with all the nursing home attendants, the cleaning staff, the cooks, the support staff who work in long-term care. The nurse in Ontario, Brian Beattie, who died from COVID, used to talk about his long-term care residents as his second family. When I think of our 5 facilities who have been in lockdown for 2 months, I'm so grateful to our Yukon long-term care staff who have been caring for residents who haven't been able to see their own families. Even more than usual, these dedicated staff have been the family that residents have depended on. Here we are again with another long weekend before us, likely the time when normally we'd be looking to go farther afield, the first summer camping weekend, or a trip over the pass to Skagway or to Haines. Well, once again, this weekend will be different for many of us. Closer to home, maybe more subdued. The borders are still closed, so no trips to Skagway or Haines, no campgrounds are open yet. But you still can enjoy the great outdoors. You can start to get out a little further from home, remembering that respectful, safe, and limited travel around Yukon is the direction we are going in. You can start thinking about your next hairstyle and which restaurants you're going to book for when the time comes. Meanwhile, please enjoy your weekend as you can and remember the Safe 6. Thank you.
Thank you. We'll go to the phone lines now. First, we'll call on Tim from CKRW.
Hi, good afternoon. Lot to digest here, but with the look, trying to look at the plan here online, what's the difference from what we've already been doing to what we are in phase 1? You said phase 1 begins today, but what are some of the hard differences here that you're now presenting today?
Well, I think as Dr. Hanley just pointed out, one of the main considerations that is new as of today is the bubble. Households now can allow 5 more people into their household, so that's a major shift. And it's one that we do very cautiously as well, and we want to make sure that we're doing this in the safe way possible. One of the biggest changes as well is the requirements for businesses and the ability for businesses to start moving forward to being opened. Yukoners can see where we're going now. Is major part of this plan is just knowing what the phases look like, past phase 1 and into phase 2, the triggers, knowing exactly what will trigger us to go forward as opposed to going backwards. But by moving into phase 1, we are gradually opening businesses that were mandated to close, which is a major announcement today. This doesn't necessarily mean that everything that was closed will automatically open today. It does mean that the guidelines are being developed to support businesses as they prepare to reopen. I had a good chat with the chair of the Business Advisory Council about exactly this, being prepared and being ready, and they were happy to know that we're moving forward for that visionary part of it, so they know what the phase is going to look like, knowing full well that we have to have some operational plans in place. Last week you saw the guidelines for the allied health community and massage therapists and the optometrists, and today we have guidelines for retail operations and summer day camps. I know that Dr. Hanley and his team are finalizing guidelines for childcare and day homes, personal services, and we also mentioned that we are ready to go forward on the household bubbles. So lots to announce today, lots in this new phase as we go down that road of being prepared to be open. Again, like I said from the beginning, it doesn't all start today, but as of today, it can start.
Follow-up question, Tim?
Okay, so it seems like there's no, like you just said, no hard deadlines. Every single business that wants to reopen will have to submit a plan. The logistics behind that, like, do you have enough people to go in and have a look and cross-reference that with those guidelines? So there's no hard date then?
Yeah, so a couple things there. So the plan is saying that the restrictions will be eased for, let's say, for example, personal care businesses during phase 1. So When will they be eased, or are they allowed to open as of today is a good question. Those restrictions will be eased when the guidelines for safe operations are developed. So I expect those to be finalized very, very soon, as early as next week. But also, when it comes to those firm deadlines that you talked about, Tim, we know that recovery and a return to normalcy is on everybody's mind right now, but we absolutely need to keep our communities safe. That's extremely important. It was a big part of our conversation at the Yukon Forum. It's a big part of the conversation as we talk with the municipalities as well. Our approach is based on our ability to meet conditions and criteria and to allowing a minimum time threshold between phases to monitor and to detect those changes and to evaluate those risks. Any significant changes in these periods, well, they're going to determine how we move forward. So that's as hard of a deadline as we're given to give at this point, because again, we are doing, I believe all Yukoners are doing a fantastic job of adhering to the Safe Six, and that's the reason why we don't have a curve here. But as we move into next phases, what happens in British Columbia is extremely important. What happens in Alberta is extremely important. What happens in the world is extremely important. We're hearing Brazil is starting to get some flares up right now, and in this other areas of the world as well. So we have to monitor situations locally, especially with our neighboring jurisdictions and partners. I spoke with John Horgan yesterday. They are cautiously optimistic, as we are, that our plan is working very well. I would say outside of present company here, they have one of the best chief medical officers in Canada. And it's the work of both of these offices that are keeping us extremely safe, and it's the work of these offices that are allowing us to consider a reopening as of today.
We'll move now to Gabrielle, Whitehorse Star.
Hi, can you give some examples of what scenarios would trigger a step backwards in this plan?
Would you? Yeah, it's all written down. So as the Premier's looking it up, that I'll answer on the fly, and really looking for basically signs of COVID coming back in. So let's say we had an outbreak that, say, a large outbreak that might really bring suddenly the public health work up to capacity and be a threat to the general public. So we might then be looking at having to clamp down. So there might be, let's say we have something else going on, another communicable disease outbreak and COVID at the same time. So maybe we'd be looking at hospital capacity being stretched for other reasons, and then we get COVID cases on top of that. So really combinations of scenarios that would stretch our capacity to deal with it.
Exactly. In the plan, there's a criteria for transitioning between phases section, and it breaks it down into 6 different categories. And this is whether we trigger a movement forward to a new phase or a movement back to an existing or previous phase. The first one being community engagement, making sure that the community engagement piece is there as we move through these phases. Number 2 is preventative measures, identifying outbreak in certain sectors that are not under control. Would be a step backwards, but guidelines for things happening in a positive way moving us forward. Public health capacity would be the third. Our ability to deal with the current situations or not be able to deal with the current situations. 4, again, is that importation risk. If we see an upward trend in epidemiology of COVID in Canada, well, that's going to set us back. Whereas if we see a downward trend in the epidemiology of COVID in Canada, then that sets us forward. Health capacity is number 5, and the last one, 6, being virus spread and containment. So again, the review that we had, the pathway forward, it's a very comprehensive document. It has lots of information in it, not only just the phases, but a real good sense of where we are today and where we want to be into the next coming weeks and months.
Follow-up question, Gabrielle?
Yeah, and are the phases set in stone? Do they act as units, or is there a chance that elements of them could be moved forward or pushed backward depending on how things are going?
Yeah, it's a good question. So each phase is kind of a package, but it does not necessarily mean that that all in that package needs to happen at the same time. So there's going to be some flexibility. You'll see that a lot of these are based on risk assessment, for one thing, and some of them are based on consultations with other agencies or departments. So an example is a lot of the school measures are going to be very closely worked on with the Department of Education. And so other areas will be, such as bar openings, are going to be risk assessments. So we might be able to progress in other areas, but hold off on bars, for example. So really, as you'll see, there are some that, because they're based on risk assessments or on working with other agencies, they may not necessarily all occur in sync.
Okay, we'll move now to Chris from CBC.
Thank you. I guess, can you offer some clarity on what this plan means for travel between communities in the Yukon? We heard that this was an issue yesterday at the Yukon Forum for First Nation government. So what communities can people travel to now under this plan? And I guess, how do you decide which places are okay for people to travel to?
So again, what I heard at the Yukon Forum yesterday, Chris, was that we're at a place right now with our communications, our weekly engagements. There are several different tables in which we are communicating, not only with our First Nations partners and governments, but also with our municipalities as well. That engagement of what's working is extremely important as we move forward, not only just to phase 1, but into phase 2 and phase 3. As Dr. Hanley said last week, we went from recommending to really limit your travel into the communities. Now we are looking at opening up the campgrounds, for example. So we're also asking Yukoners to move around a bit more. But again, we're not saying, to use Brennan's word, that we're just going to throw the door wide open. Again, think about why you're traveling, to where you're to which community, how important that is. But at the same time, if we are opening up the campgrounds, then that means that you do have an opportunity to get out into other communities. It doesn't necessarily mean that it's now time to hang out on Main Street in these communities if you're not from there. It means to be very respectful, and we are so we're so lucky to have the conduits of communication that we do have with the First Nations governments and the municipal governments and the leaders in their communities, to have that ability to see how these phases work and to see them progressing, so that the triggers that we are experiencing are communicated effectively, quickly, and that we can deal with and address issues of non-compliance if that so happens.
Follow-up question, Chris?
Well, okay, so, I mean, that particular response was not very clear, to be quite honest. And you've just given folks a 52-page document with a whole bunch of flow charts in it. I guess, how concerned are you that Yukoners are going to look at this and not really be able to figure it out and just decide to do what they want?
Well, the great news is we have an excellent website. So again, I'm urging everybody who's looking through a pathway forward to get themselves onto yukon.ca and to take a look at the guidelines that will be presented there, the operational plans, but also the phone numbers that are there to answer any specific questions that people have. Also the COVID-19 info at gov.yk.ca, also a great opportunity. We do recognize that this is an awful lot of information, but again, Chris, you'd be the first one to criticize us for not enough information. So what we're trying to do is we're striking a balance. We're making sure that all the information that is readily available is out there for Yukoners. We have information, qualification phone lines, and email addresses, and we also have the guidance of also the communities, the First Nations partners, and the municipalities as well, helping us out to share in that information as well.
Thank you. We'll move on to Jane from CBC.
Hi, I'm looking at that same document that Chris mentioned as well, and I'm looking at the transition criteria, and there are those 6 themes that you spoke about, Mr. Premier, but within each phase, there's multiple bullet points as the criteria for transition within those 6 themes. So do each of those criteria need to be met to move forward to the next transition phase? Like, do all of those points need to be fulfilled to transition to the next phase? And how many of those points need to, I guess, be lost to trigger going backwards? Do we have to lose all of those points to move back, or just 1 or 2?
Yeah, so again, it's difficult to be very precise about this, and these are really the criteria that we will use to make the judgment about going ahead, or in the hopefully unlikely case that we would have to go backwards. So it's just really it's not that we really have a formula in mind that you have to fulfill all of those. For instance, we might, and as I've said many times before, we can expect that from time to time we will get more COVID cases. As long as we're able to maintain that containment phase, then we're going to be satisfied that we have the public health capacity to carry on. It could be different combinations of these factors that would lead us to hold tight, to stay where we are till we get more stability, more confidence, really with that overall framework of are things. Can we just take a little bit more time to regain where we are? Even if we look at things like how do we judge importation risk based on the epidemiology south of the provinces? That's never going to be a black and white. It's going to be a kind of an evaluation. What if we had large outbreaks that occurred in one of the major provinces? Well, we're going to look at that very closely and very carefully and see whether that is posing an additional risk for Yukon that would mean we'd want to stay put for longer before we get even close to, say, having more exceptions for who may be allowed in from Yukon.
Yeah, I would just add to that, the decisions being made by the government, Yukon government, to move into next phases will absolutely be guided by the recommendations of the Chief Medical Officer of Health. On a weekly basis, we have check-ins from Dermot and his team, John Stryker, Minister Stryker and his team, Pauline Frost, Minister Frost, and Health and Social Services, Tracy McPhee, our Attorney General, and her team, legal, Ranch Pillay and Jeannie Dendy's on the economic front as well, and we also have the chiefs engagement that we do in the municipality as well. It's a lot of oversight for sure. The triggers, the criteria that you mentioned, those are our guiding principles. Those are the things that we have to consider, we have to look at as all of these groups, as we get together on a weekly basis to see how we're doing. There's definitely there's no mold, I guess, per se, but there is an awful lot of very well-intentioned and well-educated people that are monitoring the situation, making sure that our number one goal of not having a curve and not having a strain on our medical community is still a reality, and with our second goal of making sure for the mental wellness and the social wellness and the economic benefits of Yukoners that we are able to move more freely around the Yukon and to have an economy.
Thank you. Next question, Jane.
I have a follow-up question here. Based on phase 1 restart, which is the current phase we're in, it says for indoor public recreation centers and libraries, restrictions may be eased based on public health assessment, strict infection prevention and control measures, and an operating plan will be required. So I know we talked a lot about business today having operating plans. Is there any chance that we'll see libraries reopening in this phase anytime soon, or recreation centers like the Canada Game Centre?
Yes. Again, if we look at Canada Game Centre, for instance, that is something we're very interested in working with the city on. I think I've mentioned before, but obviously there are a lot of complexities to that. So it's not something that you can simply open from one day to the next. But it may in itself need phases of reopening, or certain areas to be reopened, and then it's working with the city for how will that be actually operationalized. So definitely something that we are very interested in working with the city on, and we have been working with some of the communities on recreation facilities in the communities already. And similarly with the library, we're very interested in working with our partners to look at library reopening again, just as working together through the criteria needed to do that safely.
Thank you. We'll move now to Chuck from Shone FM. Chuck? We'll move on and come back. We'll go to Gord from Yukon News.
Sorry, can you hear me now?
Yes, sorry, who do we have?
It's Chuck. Sorry, good afternoon, Dr. Premier Silver. Not being privy to the Yukon Forum yesterday and the previous day, I'm just wondering, with the self-governing First Nations that do have states of emergency, what would your advice to them be? Should they stay with the status quo, or perhaps with these evolving phases look at changing their situation?
Great question, Chuck. Based upon the conversations we had at the forum, but also the individual conversations that I've had with the individual chiefs on phone calls and texts, I am pleased that each of those governments are following the recommendations from the Chief Medical Office. I know, for example, Nashada Hene in Tesla and Clinka Council, they are moving forward on a plan to reopen. They provided that plan to Dr. Hanley's office, keeping in close contact to make sure that that again, all governments are moving based upon the best scientific and public health information possible as we move together forward.
Next question, Chuck.
Champagne-Atiac, yes. So with Champagne-Atiac and Oak Grove, have they discussed any plans similar to that of Teslin?
Yeah, so again, not to be able to speak on behalf of those First Nations governments, those are great questions for Chief Smith and Chief Tizia Tram. Again, great conversations from those leaders as we had our Yukon Forum yesterday. Again, from what I'm hearing at the Yukon Forum and from my conversations and Minister Frost's conversations, we're all pretty much in lockstep that the best pathway forward for our elders and for our most vulnerable people in the communities that don't have as much access to public health and that you would have in a major center is that we follow the advice of the public health authorities, and I am confident that all of the municipal and First Nations and territorial governments here in Yukon are exactly doing that.
Thank you. We'll move now to Gord at Yukon News.
Yes, I'm just looking to build off of Jane's question. Was the CGC actually ordered to close?
So what happened was that there was a decision. There wasn't a direct order for CGC to close, but a decision after some conversations with city officials, a decision made by the city to close just because of difficulties complying with the public health requirements, such as handling the numbers of people and being able to observe either heightened sanitation requirements or the physical distancing requirements. So a lot of complexities, especially having to make decisions in a short time, as we were in the times of declaring the public health emergency. So that was, let's say, it was a mutual decision rather than a direct order.
And it's a very good question for example, businesses that didn't have to shut down but decided to shut down. If you weren't in that group of businesses that were ordered to shut, and if you just made the decision that you're going to take some time, again, as far as reopening, you don't have to have that reopening plan as of right now. It's something you need to work on, and Dr. Hanley said the date of by the end of the month to have those in place. However, if you were in that category of businesses that were mandated to close, before you open, you need to have the operational plan in place. I know that's a little bit confusing, but again, all of that information is well laid out at yukon.ca. So whether or not you are, the organizers at the Canada Game Centre, or a business that wasn't ordered to shut down but did shut down and wanting to reopen soon, or one that was mandated to shut down, your lanes, I guess we can say, are all going to be very well defined in the coming days. The team has worked extremely hard to get to where we are right now with showing Yukoners what the path forward is. Today's the day that we start that new phase, and in the coming days and weeks, we will be working with our stakeholders in each of these categories to make sure that their transition back to an economy, back to programs and services is expedited as quickly as possible.
Thank you. Next question, Gord.
Now, understanding this will be at the mercy of, we'll call it Mother Nature, for lack of a better term, how long would you estimate phase one would last?
That's it's a good question. I appreciate that that's a concern of everybody's. There's just so many variables at play for that answer. The best that I can say right now is, let's say we have a very smooth transition locally in getting operational plans submitted and getting folks up and running into phase one. Then we have to wait, that 2 to 4 week period to make sure nothing bad happens. Make sure that the 6 categories of triggers that we're looking at are positively affected as opposed to negatively affected. But there is a 2 to 4 week minimum once we get things in place where we absolutely will need that time to look at the epidemiology.
Yeah, I might just, I agree. So that's why I really emphasize that we commit the time frame to more of the transition period between phases, but not commit to a time period for each phase. I mean, in reality, we're looking at anywhere from weeks to months per phase. And as I say, I think the first phase is a really big step. It in itself, as the Premier said, is not everything happening on day one. It's going to take a couple of weeks even for everything in phase one to be kind of clarified and to be realized and operationalized, and probably weeks beyond that. So it's a progressive phase, and once we're once we have all of these businesses that want to be up and running and doing well and confident, then we're in a kind of a consolidation phase. Just like we have been consolidating this previous phase of the where we have been in the phase 0 or the current state. We need to consolidate that phase, and then contemplate going ahead into the subsequent phase through a transition period into phase 2.
We'll move now to Julien Roboreal. Julien?
Oui, désolé, merci. Donc, ma question est pour Monsieur Hanley. Donc, je me demandais si c'était possible de répondre en français. Pourquoi c'est difficile de donner des périodes de temps ou des dates claires pour les phases, malgré la présence d'un plan?
The question is for Dr. Hanley. Given what you have said at this point, can you repeat in French why it would be difficult to give definite dates or definite periods of time to go from one phase to another one?
Oui, donc ce serait similaire de ce que j'ai déjà parlé, mais traduit en français. Donc, ça prend un bon moment juste pour réaliser toutes les opérations de consolider où on est dans la première phase. Dans la première étape, ça va prendre au moins quelques semaines, sinon des mois, pour vraiment être, parce qu'il y a tellement pour arriver des entreprises, des commerces, des services personnels, donc beaucoup des établissements pour réouvrir et pour rétablir leurs services, que ça va prendre un temps que c'est difficile à devenir. En même temps, on a aussi il faut avoir la confiance pour être de continuer dans un bon état vis-à-vis le COVID-19. Donc, c'est pour assurer la balance. Et donc, quand tout est bien établi, on sera dans une position de contempler la prochaine étape, la prochaine étape avec phase 2. Donc, oui, c'est pour ça, c'est difficile à dire. On voit que entre des semaines et des mois pour chaque phase, pour chaque étape, et entre 2 et 4 semaines pour la transition une à l'autre.
As-tu une autre question, Julien?
Oui, merci. Ma question, je pense qu'elle peut s'adresser à M. Sandy Silver. C'est sûr qu'en ce moment, l'été approche très vite et je désire un peu plus de clarté pour savoir si, par exemple, les 30 jours qui doivent bientôt rentrer en opération ont une date limite pour fournir leur plan opérationnel pour la reprise des activités.
So the question is for the Premier. Given that summer is coming really quickly, do you have an idea of dates for day camps, for example, to submit their plans so that they can be open in the summer?
Yeah, so no specific dates right now, but as I mentioned in my speech to begin with, Dr. Hanley's team is working on those provisions as we speak, basically, and those should be ready early this week coming up.
Oui, je peux ajouter qu'on a déjà reçu des applications et des plans pour les camps pour les camps d'activité. Donc, ça, c'est déjà un processus. Ce qu'on n'est pas encore prêt pour les camps comment dire, les camps de plusieurs jours, mais le camp de jour, effectivement, c'est déjà ouvert. On est déjà en train approuver ou d'aviser sur les plans pour les camps différents.
Thank you.
I'll just say that. I just said that we're already receiving applications for camps and reviewing day camp applications. We're not in a position to approve overnight camps at this point, but we through our what we call the RAD, which is risk assessment decision team, that we are looking at applications and giving advice and improving them for the summer camps.
Thank you. We'll move now to Nick from Canadian Press.
Nothing from me.
Thank you. Clariane, Radio-Canada.
Oui, juste pour savoir, il y a eu beaucoup de plaintes
alors, un manque de consultation, c'était une des premières nations du secteur privé, même de certains organismes comme les garderies. En allant de l'avant, a-t-on l'intention de consulter davantage les gens avant de passer à une nouvelle phase?
So at this point, there was a lot of consultation, discussions with different groups, retailers, First Nation, and the question is, are we going to have more of these consultations as we are moving from one phase to another one?
Absolutely, Claudian. You know, it's imagine back a couple of months ago, before any of this, none of these you know, COVID-specific conduits were in place. However, you know, a whole of government approach that we've been developing over the last few years is so instrumental into our ability to use that approach for COVID-related issues. The Yukon Forum having all of the 16 different working groups, JSEC, all the fantastic work that the Association of Yukon Communities does. You know, all of those conduits of communications being up and running before COVID were instrumental. And then to have everybody come together, you know, we didn't get it perfect from the get-go, but what I did notice at every turn was whether it's Dr. Hanley's team or Health and Social Services or the folks that are implementing the emergency measures, Dermot and his team, everybody, you know, Jeff Ford working upstairs in Executive Council for my team with his crew, everybody's so willing to take what we've learned on a weekly basis and apply it to a new normal. We would be remiss if we went from this backwards. We now have these conduits. We have excellent partners in the community. You know, it's just an amazing place to be right now, all of the different conversations that are happening. I would have thought by now that people would have been burnt out, but what I see, whether it's in First Nations governments, municipal governments, the Chief Medical Office, ECO, all of the departments, everybody is attuned to the important work that we're doing. And post-COVID, when that reality comes, this will make us stronger. We will be better as a society because we have created so many pockets of communication through these trying times. And I know they are stressful and trying times, but I'm surrounded by a bunch of hardworking optimists that make my job easier in these uneasy times.
Merci. Et je vais juste ajouter que Claudienne, que c'est, à mon avis, c'est fondamental de continuer les conversations avec tous ces groupes que le premier ont mentionné, mais aussi pour répéter qu'il y a des critères, des 7 critères, je crois, pour continuer. Par exemple, de maintenir les mesures publiques, d'entretenir la capacité de santé publique, la capacité de réponse aux éclosions, la capacité de dépistage. Mais entre ces critères, c'est l'engagement communautaire. Donc, c'est fondamental pour continuer de réussir.
Thank you. Prochaine question, Claudienne?
Oui, dans la même veine, Dr. Hanley, dans quelle mesure est-ce que vous allez être capable d'ajuster les lignes directrices d'opération aux réalités de chaque organisme? Par exemple, si un camp de vacances est dans une position particulière, dans quelle mesure êtes-vous capable de pouvoir ajouter des lignes directrices pour cet organisme-là, ou pour ce commerce-là en tout particulier?
The question is for Dr. Hanley. To what extent are you going to be able to adjust the guidelines for specific circumstances of these different organizations? How far can you go into looking at individuals and saying that you can adjust the guidelines for each one of them?
C'est une très bonne question et ça dépend de la catégorie d'établissement. Et donc, c'est important de différencier entre, par exemple, les établissements qui sont sous l'acte de loi santé publique, par exemple les services personnels. Donc, mais on sait au même temps que c'est pas pratique de juger chacun individuellement au même temps. Donc, on a formé le plan de recevoir les plans et pour avoir un système rapide pour approuver les plans qui effectivement, tous les éléments des plans sont fournis. Et donc, pour dire un rapide turnaround pour ces demandes chaque par chaque. Mais pour l'inspection plus détaillée, on reconnaît que ça va prendre le temps, et donc ça peut arriver dans les semaines qui viennent, selon la capacité de l'inspection de santé environnementale. Mais sans limiter la capacité pour l'établissement d'ouvrir. Mais pour les autres endroits, comme les entreprises qui ne sont pas sous l'acte de loi, ils sont ouverts. On a la confiance pour eux de suivre les guides qui sont là, disponibles, mais avec la possibilité d'avoir une inspection sans avis. Donc, I was saying that the question was about can we keep up basically with the capacity to follow individually how each establishment is able to comply, and it really depends on those that are under the Public Health and Safety Act, which do require an inspection, but we have a mechanism for assuring a quick turnaround. Have your plan, submit your plan. We will, through the HEOC, make sure that plan is complete and looks good. Then we can tick it off rapidly, allow the business to get established, and then an inspection process can occur in the weeks to come, but without holding up the ability of that, for instance, a restaurant or personal care service to open. But for the general retail that are not under the Act, there are guidelines available. It's up to them to comply with the guidelines, and they need to have their plan submitted to workers or WCB, but without having to wait for specific approval. But again, subject to inspection by WCB down the line. So hopefully that combination between efficiency, not holding up processes, but compliance with the safety requirements.
Thank you. We had committed to a second round of questions. I will call your name. You will be given the opportunity for one question, no follow-up. If you have no questions, please let me know. Tim, CKRW?
Hi, my question is for Dr. Hanley, and it pertains to dine-in restaurants. Just reading here on the plan, dine-in restaurants cannot operate until the CMOH lifts the order, guidelines are published, and the operational plan is approved. So is this individual orders? Is this an overall order? And when do restaurants who are dine-in only get those guidelines?
So 4 elements really: order, guideline, plans, inspection. So the order will be the general order that can be lifted, and that will be soon. That really depends on cabinet, so I obviously can't commit, but within the very near future. The guideline is being finalized as we speak, so I expect the guideline to be available by early, probably into next week. And then the restaurant makes their operating plan based on the guideline, submits it. When it's being submitted and we see that the guideline is complied with in the plan, that the plan reflects what is needed in the guideline, we then the go ahead for that restaurant to open will be given, and then, as I said, the inspection is the last thing. So that we're not holding them to the inspection before they reopen, but they will be subject to inspection according to the schedule of the environmental health officers.
Just on the cabinet aspect of that, Tim, that's early next week.
Thank you. We'll move to Gabrielle, Whitehorse Star.
Hi, looking at the charts in the Path Forward document, it looks as though most businesses will follow the reopening plan that they're working on now until a vaccine is available. Can you just confirm that I've read that correctly? And so does that mean business owners need to look at a longer term lens of perhaps 12 to 18 months until a vaccine is available when they're working on these plans?
Yeah, so I think what you're looking at is the line that probably says continued through the different phases. Mm-hmm. So it really means, so the expectation is that the workplace, the requirements to operate under physical distancing for really as the fundamental component of this for workplaces, apart from things like, limiting customers and enhanced sanitation. It's really all about maintaining safe spacing within the workplace for staff and customers or clients. And so, yes, so if your question is that what we expect until we get to vaccine, then yes, that will be the expectation. Because until we get to that scenario of vaccine available and into arms, then we're not going to be in a low-risk COVID situation in the country. The only alternative might be having, if we don't get to a successful vaccine, that obviously we will have to look at other strategies. One of them would be effective treatments available so that COVID is no longer the threat that it currently is.
Thank you. We'll move to Chris at CBC.
Thank you. And Mr. Premier, as you're probably aware, the opposition parties co-signed a letter yesterday to you asking for you to recall the Legislative Assembly to talk about the government's measures to combat COVID-19. I also understand that the opposition parties say that the government is now ignoring their request to talk about making arrangements to have meetings about this. So do you want to, I guess, I just take this opportunity to answer the opposition's questions if there is going to be a sitting in the Legislative Assembly, and if not, why not?
Good question, Chris. So again, we made a commitment that the departments would be available for the critics to do the scrutiny of the departments for the budget that we passed. And we unanimously passed that budget in the fall. The opposition, whether or not they take us up on that offer, that's up to them, but that is the offer for the current budget. When it comes to COVID expenses, it's like wildland fire management in the fire season where we have fires burning late. It's a regular process to tally all of those emergency expenses, and in the fall we will also absolutely have the opportunity for the critics to do their job and to do the scrutiny of every single budgetary item COVID related. So we have two opportunities that we are offering for the opposition. Whether they choose to take it or not for the offer in May for the current budget, that's up to them.
Jane, CBC.
I'm wondering how long will it take to for these businesses to develop the operational plans? If we're still guidelines are being developed, there are some guidelines available now. But how long will it? How long will it take for those businesses? Sorry.
Sorry, Jane, we're having some difficulty with your call.
Sorry, there's someone else talking at the same time.
If folks can mute their phones.
Can people please mute their phones?
So I'm just wondering how long will it take for the businesses to develop their operational plans, get those approved, and then reopen? I'm not sure if you can hear me.
We can. Again, can people please mute their phones if they're not asking a question?
Okay.
Do you know who that is?
Who's on that line?
10h50.
Yeah, would you?
S'il vous plaît, Si vous pouvez silencer votre téléphone, on voudrait continuer avec notre conversation ici. Alors, le monsieur qui parle en français.
Merci, Audrey.
Oui, merci.
Tu peux me texter.
No.
Okay.
I don't think he hears me.
Bye-bye.
I don't think he hears you either.
Okay.
Oh,
Thank you.
there you go. He finished his call.
Sorry, Jane, can you give us that one more time?
Sorry.
Of course. Just wondering, how long will it take for these businesses? It sounds like there are some guidelines that are still being developed. How long will it take for the operational plans to be approved and then businesses to reopen? Do you have a sense of how long that process might be?
I think we're well prepared. We had a similar concern in the previous weeks of businesses coming to us that didn't have to close but did to kind of wrap their heads around the requirements. And so in that time, we have established phone lines and information, email addresses, that type of thing. So we've been working on the mechanisms of that for quite some time now. I think we have that all up and running very well now, so that we expect a big surge in that capacity. The phone lines, we heard today that they were at about 70% capacity this week, answering questions that were non-medical, these types of questions that businesses and others were putting in. So we do have a little bit of buffer there and monitoring our ability to answer those questions as quickly as possible. And like Dr. Hanley said, he's prioritizing the operational plans and making sure that we get those out the door as quickly as possible with our teams. So I think we're well suited. We won't know how quickly until we start that process, though. So we believe we're well suited to be ready. It's anyone's guess right now, though, as far as how quickly that's going to get expedited next week.
Thank you. Chuck, Sean?
No, I'm okay. Thank you.
Thank you. Gord, Yukon News?
I'm curious, since a fall session was mentioned, at this point, do we know if the fall session will go ahead as planned?
Yep. Well, we hope. Again, that's October from now. So all things considered, COVID related, but we would be confident in that there are regular dates for our fall session, and we hope that COVID does not interfere with that. But I think by all accounts that should be on schedule.
Thank you. Julien, Aurore Boréale?
Non, pas de questions, merci.
Merci. Nick, Canadian Press? No, we'll move on. Claudienne?
Oui, Premier, how much has this pandemic cost so far, and how much are you anticipating it will cost in the coming months?
Yeah, that's a great question, Claudienne. As far as dollars for our programs to date, the Yukon government's spending, we are just under the $27 million mark. There's a bigger philosophical conversation about the mental costs, the mental health costs, those types of things, and a bigger conversation as well about the economic costs of our businesses and our communities. Direct cost to our government as far as incentives is reaching around $27 million. We do have, Claudienne, a list of all of the initiatives so far in the plan from our government. If you add into that as well our portion of federal funding, you get up there into quite another larger number as far as the actual fiscal costs between our two governments. Talking to the First Nations governments as well about their accommodations, and municipal governments as well. There's a cost there. This is it's definitely unprecedented times. It's something that we will be calculating all the costs of for weeks and months and years to come.
Thank you. Thank you, Premier Silver. Thank you, Dr. Hanley. Thank you, everyone, for your time today. A reminder that we will not be updating the COVID-19 results over the weekend. The next update online will be on Tuesday, May 19th, to coincide with our COVID-19 update at 2 p.m. Thank you.